Welcome to the Emergency Management and Preparedness Inclusion of Persons with Disabilities webinar series. I'm Louis Krause from the Pacific ADA Center, your moderator for this series. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232. Real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the CC icon in the meeting control toolbar, shown there on your screen. To toggle the meeting control toolbar permanently on, press the Alt key and press it again. This presentation also has ASL interpreters on video. If you would like to adjust this video on your screen, you can go to View Options at the top of your screen and select Side-by-Side mode to move the video to a different place. To remove any non-video participants from your view, you can right-click on the participant video and select Hide Non-Video Participants. As always in our sessions, only the speakers will have audio. If you do not have sound capabilities on your computer or prefer to listen by phone, you can dial 1-669-900-9128 or 1-646-558-8656 and use the webinar ID of 155545130. I also want to remind everyone that the webinar is being recorded and will be able to be accessed on the ADA presentations site in the archive section of the emergency management area next week. This is the 7th year of this webinar series, which shares issues and promising practices in emergency management, inclusive of people with disabilities and others with access and functional needs. The series topics cover emergency preparedness and disaster response, recovery and mitigation, as well as accessibility and reasonable accommodation issues under the Rehabilitation Act of 1973, the Americans with Disabilities Act of 1990, the ADA, and other relevant laws. Upcoming sessions are available at adapresentations.org under the Schedule tab in the Emergency Management section. These monthly webinars occur on the second Thursday of the month at 2:30 p.m. Eastern, 1:30 Central, 12:30 Mountain, and 11:30 a.m. Pacific time. By being here, you are on the list to receive notices for future webinars in this series. The notices go out 2 weeks before the next webinar and open that webinar to registration. Excuse me. You can follow along on the webinar platform with the slides. If you are not using the webinar platform, you can download a copy of today's PowerPoint presentation at the adapresentations.org webpage in the Schedule section. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. The speakers and I will address them at the end of the session, so feel free to submit them as they come to your mind during the presentation. To submit your questions, go into the chat area text box and type your question, or press Alt-H and enter the text in the chat area. If you are listening by phone and not logged into the webinar, you may ask your questions by emailing them to us at adaTech@adapacific.org. That is ADATECH@adapacific.org. If you experience any technical difficulties during the webinar, you can send a private chat message to our host by typing in the chat window, or you can type your comment in the text box and enter. If you're using keyboards, you can use Alt-H to access the chat box via the keyboard keys. You can also email us at adatech@adapacific.org, or you can call us at 510-285-5600. Today's ADA National Network Learning Session is titled FEMA's Perspective on Emergency Management, COVID-19, and People with Disabilities. This session is going to provide an overview of FEMA's roles and responsibilities in the midst of COVID-19, how FEMA continues to serve people with disabilities during their response, and how they've continued to plan and prepare for the 2020 natural disaster season in the midst of the pandemic. Today's speakers are Charlotte Lewis. Charlotte is the current Acting Program and Policy Branch Chief for the Office of Disability Integration and Coordination at FEMA. Charlotte brings in field experience from her years as a disability integration advisor, including deployments to Texas for Harvey, US Virgin Islands and Puerto Rico for Irma and Maria, with the most recent deployment being in support of Region 9 and the state of California in their COVID-19 response. Roxanne Crawford serves as the Disability Integration Specialist for the Department of Homeland Security FEMA Region 9. Before working in the region, Roxanne was a Disability Integration Advisor on the National Incident Management Assistance Team West. Candace Alder serves as the Disability Integration Advisor and Policy Analyst, specializing in program access within FEMA's Public Assistance Program. Ed Ahern is a policy analyst with FEMA. He has broad government, nonprofit, and public sector experience, working with many aspects of disability, including advising on physical access, awareness training and education, and inclusive program design. And Jessica Gottsman. Jessica serves as the Data Analytics Program Analyst for the Office of Disability Integration and Coordination, ODIC. In her role, Jessica collaborates across FEMA to help leaders make data-driven decisions regarding services to people with disabilities. She collaborated with FEMA's Recovery, Reporting, and Analytics Division to produce a first-ever publicly available Disability Demographics and Program Utilization Report, which analyzes the utilization of FEMA programs among people with disabilities who registered for FEMA assistance. All right, we are happy to have all of you with us. I'm going to now turn it over to you, and I believe, Charlotte, you're going to begin.
Hi, everyone. I'm Charlotte Lewis, and I'm speaking through an interpreter. Can everybody hear me okay?
Yes, we hear you fine.
Great. Awesome. So first of all, I just wanted to thank Louis Krause and all of the ADA Pacific team for letting us be here today to talk about what we've been doing for and from FEMA's perspective with the COVID response. So thank you, Louis.
Maybe.
So before we dive in to specifically what our office does, I just wanted to give kind of an overview of what FEMA has been doing for the response. So if you don't mind moving to the next slide, please.
My iPad is plugged in and I don't think we need that.
And Louis has already introduced all of us individually, and everyone will get a chance to talk about their part and how they've been impacted, and their work has impacted the COVID response. So we don't need to go over that again. So next slide, please. So we want to discuss, first of all, the FEMA Whole of America overview of FEMA's response. Jessica is going to go into some detail about the data that we've seen and how COVID specifically has impacted disability communities, and explain more what that looks like and what we've seen. Then we'll start explaining more about what the regions have been doing and what people at the headquarters level has been doing and at the field level. Then we'll briefly touch on our hope for outreach with stakeholders who have been supporting our response effort.
So
next slide, please.
Kind of go over in this area. Huh.
Next slide, please. And next slide, please. So as many of you already know, FEMA's mission is helping people before, during, and after a disaster. And I think that this has been especially important during this COVID response because COVID is still very active, but at the same time, we need to prepare how to respond to other disasters during COVID times. And COVID is kind of in a weird place now too. We've established a lot of things in many places, and we're still trying to figure out and evaluate what works and what doesn't. So I feel like we're working in all three phases really, before, during, and after disasters all at the same time. So this has really been a unique and very different experience than other natural disasters that we've responded to. Next slide, please. So on March 13th, 2020, the president declared a nationwide emergency specifically for COVID-19. And the declaration covered all 50 states, 5 territories, and many tribes, either under the states or directly to the federal, which means that it has impacted the entire country. So that's required a lot of creativity in figuring out, okay, now what do we do? And what's next? And what is the impact? And how do we address some of those impacts? So because it has impacted all of us and all over the country, it's not a specific location, which creates some barriers. So for example, a limited ability to use mutual aid agreements or a memorandum of understanding. Often during local responses, states can partner with other states because maybe a hurricane hit a specific state and they can get a hold of another state that hasn't been impacted to borrow some of their resource and pull some of those resources from there. But during COVID, there's not an area that hasn't been impacted. So that's been a very unique factor for the response for this specific event. Also, because of the way that COVID spread so quickly and so severely, we have a limited ability to give in-person delivery for any services and program activities. So that's forced us to be really creative and diligent about how we can offer services and support the states and local governments for their responses. And in addition, it's been such a huge impact on the supply chain for shipping, for manufacturing, for a variety of things. Again, and that goes back to the fact that we can't just tap into the resources of the next state over and tap into their supply chain. So those are examples of some of the barriers that FEMA's seen as a whole that hasn't just impacted people with disabilities, but that has a great impact on how response is delivered in general. So FEMA has also partnered with Health and Human Services for delivery of equipment and provide services. And we've combined spent $153 billion in a variety of commodities for equipment, personal protective equipment, staffing, food, sheltering, crisis counseling, and public assistance in their Category B emergency protective service measures. And that will be discussed later in this presentation. Next slide, please. So for commodities and equipment that we've been distributing includes personal protective equipment, so like N95 respirators, surgical masks, gowns, visors, face shields, some of the other medical equipment. We also help states identify and establish testing sites. And the idea behind that is that if the sites are federally run and established in a federal way, then the responsibility can be transferred to the states, because that really starts at the local level. Local, state, tribal, and territories manage their own responses, and we're here to support them in that. And throughout the COVID response, we've seen very large gaps in the nursing homes and distribution of equipment and spread of COVID in nursing homes and other living assistance facilities. So delivering personal protective equipment has been important specifically for those facilities. And we have statistics and numbers and all that stuff about how much equipment we've delivered. We have that information, but I don't want to go too much in detail with and overload with all those numbers. So if you're curious about the specifics, we do have the information available. You can go ahead and ask those questions during the Q&A. Next slide, please. And then I will turn the time over to Jessica Gossman to do her part.
Hello, everyone, and good afternoon. My name is Jessica Gossman. I am the data analyst for ODIC. And today I'll be talking about some of the COVID-19 impacts on people with disabilities from a data perspective. Next slide, please. Okay, so the first thing that I wanted to mention was just to make sure that we're all on the same page, understanding a few basic things about COVID. So one of them is merely having a disability does not automatically mean that you're at higher risk of having COVID-19 or of dying from COVID-19. Your risk of having or starting to have COVID-19, coming down with it, is linked to exposure, of course, to someone who currently has the virus. So it's exposure and it's also length of exposure. Okay, well, where this has to do more specifically with people with disabilities is really where it comes to people with underlying medical conditions. Of course, not all people with disabilities have underlying medical conditions. For people who do have underlying medical conditions, however, you may be at higher risk if you get COVID to have a more adverse health reaction to it. So, for instance, there was a CDC study that was done looking at people who were hospitalized for COVID-19, and specifically people who had died from COVID-19 who had been hospitalized for it first. And they found among the 300 individuals that they looked at that 90% of them had underlying medical conditions before contracting the virus. The other thing I wanted to mention, though, is that we do find that people with certain types of disabilities have in fact died from COVID at higher rates than people without disabilities. And I wanted to go through a little bit of the reason behind that. So one thing was people with intellectual disabilities have actually died from COVID at a rate 2 or more times higher than people without intellectual disabilities. Now, the reason for that, again, has to do with exposure and length of exposure. So in this case, the reason for this is that it's especially coming from group homes for people with intellectual disabilities. So if someone's living in a group home environment, this was obviously very true for nursing homes as well. It's been true for group homes with people with intellectual disabilities or group homes for other reasons as well. That unfortunately, that just means that the risk of exposure is a lot higher, and that if that also intersects with underlying medical conditions, the adverse reaction to COVID could be a lot worse. So I would direct your attention to, if you're interested, to an NPR article that came out recently specific to people with intellectual disabilities in group homes, looking at several different states and the rates of people who've died from COVID based on that. A couple other things. So 8 out of 10 people in the US who have died from COVID-19 are adults who are 65 years and older. So we know that age can also be a factor in terms of the likelihood of an adverse health reaction to contracting COVID-19. And I mentioned this a little bit earlier, but the Center for Medicaid and Medicare Services, yes, I will send out a link to the NPR article after this, absolutely. So the Center for Medicaid and Medicare Services, their data demonstrated that roughly 40% of COVID deaths took place in nursing homes. There have been some other estimates that even estimate that just a little bit higher than that, but it's somewhere around 40%. Again, that has to do with the proximity of people with underlying health conditions, especially. Of course, it's not only limited to that, but especially for that, who are living in close proximity to each other. And then last thing I wanted to mention in terms of general data is that one of the biggest concerns for families with disabilities during the lockdowns has been food security. So for people who were used to having their food source come from, whether it be a food bank, from food delivery services, from a number of different sources, a lot of that was disrupted during COVID. And in some cases still is, though a lot of that seems to be better now. And we did hear from a number of different sources as ODIC reached out to stakeholders that this was a significant concern. Next slide, please. There's also been a lot of concern regarding equitable access to services for people with disabilities. That's included communication access, including language access, making sure that you're getting information in a way that is helpful to you, and that when you go to a medical facility, for instance, that you have the support personnel and you're allowed to bring in the care that you need and the people that you need to help you. There's been a lot of concern about quality of care standards, and there's been concern also about the use of face masks and when that is and is not required. So I'm going to put this in the chat function, but one thing that I want to draw your attention to is the Health and Human Services Office of Civil Rights Bulletin. So there was a bulletin that went out called Civil Rights, HIPAA, and the Coronavirus Disease 2019. And that statement is all about ensuring that entities covered by civil rights authorities keep in mind their obligations under laws and regulations that prohibit discrimination on the basis of race, color, national origin, disability, etc. So I want to draw your attention to that. Again, I'll put it in the chat function for anyone who's interested later, along with the NPR article that I mentioned earlier. Okay, so a couple more things before I finish up today. One thing is that ODIC participated in a food security working group with HHS and a number of different agencies, as well as a number of non-governmental organizations. So we spoke with the leaders at the Salvation Army. We talked to the Association for Community Living, and a number of other organizations that were partnering to either provide funding or provide services directly or provide volunteers to help with communities at the local level. And we do have something in FEMA's public assistance that's sometimes called Category B funding. So under the COVID-19 pandemic, purchase and distribution of food eligible for public assistance policy, otherwise known as Category B, or sometimes you might even hear us say Cat B funding, FEMA could provide funding for an initial 30-day time period. And, but even beyond that, states, local government, tribal, territorial governments could request a 30-day time extension from the regional FEMA administrator within their region with documentation showing why that extension would be necessary. And we were able to clarify that indeed those extensions are available when necessary as emergency protective measures. So that resulted in a lot of additional food and supplies and so forth being distributed through the use of that funding to help cover some of the concerns regarding food security and so forth. Okay, I look forward to any questions during Q&A. Again, I'll drop those two links in the chat function. And otherwise, let's please go to the next slide. And I'll turn it over back to Charlotte. Thank you.
Okay, if you would move on to the next slide, please. This is Charlotte, by the way. The Office of Disability Integration and Coordination, their mission is in support of FEMA's, in which we help with all phases of recovery before, during, and after disaster, specifically people with disabilities or who have action or functional needs. Next slide, please. Because of the post-Katrina emergency Reform Act. They required the Office of Disability Integration Coordination to do a few specific things. One is provide technical assistance and advisory service to FEMA leadership. And in 2008 to 2010, the office was set up. There's a little bit of history about our office. That's when it kind of started. And as part of that process, we've kind of set up a desk in the National Coordination Center, and that desk is heavily involved in the response for COVID. And that role is to facilitate information from the field and at the regional level to FEMA leadership. So we make sure that we're figuring out who needs to go where and what needs to go where and where we can get resources from and that kind of things. And that's what the desk in the National Response Coordination Center, or NRCC, is. And we do still have a person assigned to the NRCC even now who's tracking the response and identifying any potential gaps that we may need to pull resources in for. We also partner with other FEMA program areas and working groups, like, for example, the food working group that Jessica mentioned. We work with many other groups as well to work for that. Next slide, please. So we have different relationships and different collaborations that we've been working on throughout this response. And we've connected with all 10 regions, the disability integration specialists, who each have their own network and connections on the regional level. Roxanne will be speaking about that a bit later. And the work that we've been doing in the National Response Coordination Center, the NRCC, facilitates the information flow to all of those people who will need that information. We also connect with the individual assistants and work for several emergency service functions, or ESF. So the emergency service function, or ESF number 3, is focused on public works, public infrastructure and things like that. Emergency service function number 6 is mass care, and that plays a big role in food delivery, sheltering, and right now the biggest push is identifying what to do for sheltering during the current hurricane and fire season, and how we provide safe sheltering options and how we can support the Red Cross in setting that up. So that's something we've been really working closely at and working with individual assistants very closely on. And emergency service function number 8 is public health. So each state has their own public health team, and as FEMA, we stand ready to support each state and territory in providing what they need at that level. And emergency service function number 15 is the Office of External Affairs, and they have a big focus on communication access, language services, not only for sign language, but also for people who English may not be their first language, and providing information in the language they need, and how we can partner with other federal agencies like the Center for Disease Control, the CDC, and Health and Human Services, HHS, to make sure that we're providing successful communication access at all points. And of course, the Office of Equal Rights. They are the people who focus on civil rights and how FEMA can ensure that the civil rights of people with disabilities and other protected classes, and making sure that they're protected during the response. Next slide, please. So before I took the role of acting program and policy branch chief, I was deployed to the state of California, virtually deployed to the state of California to support California and Region 9 in their COVID response. And one thing I do want to mention is that we could not have done this work without the fantastic work with our disability partners and stakeholders, and to have them provide us visibility on what's happening on the ground was key in shaping this response from FEMA's perspective. And so I do want to give a shout out to the Pacific ADA team, because they created documents for checklists and accessibility of testing sites that were such a big help. And that team wasn't the only team that supported us during that response, but that was very helpful information that didn't only help California and Region 9, but other regions throughout the United States and the rest of the country. So thank you very much. So in that role that I played supporting California, my role was also facilitating information and pulling intel and information from disability partners, seeing what was happening on the ground, identifying what possible gaps are and how we could figure out how to address them. This was much different than any other response that I had ever worked, because the resources were much more limited, the supply chain was limited, and the question was how can we pull those resources? And really the US hasn't gone through a pandemic of this size and proportion since probably the early 1900s. So that was really a big challenge, and definitely a unique challenge. So we've connected with many different parts of the team. Volunteer agency liaisons played a really big role as well. We connecting them with disability stakeholders, making sure that people are connected where they should be, and figuring out who should be talking with who and who we can pull resources from. And we shared information about some of the new processes for public assistance Category B support, trying to disseminate that information. And FEMA has a good amount of resources, and we want to try to figure out ways where we can distribute that support to areas that need it, and figure out how we can adjust and respond in the way we need to. And I hope that some of the new innovative things that we've been doing with this response can be applied to localized and other national disasters. I don't want to say traditional disasters. That doesn't sound right, but the fact that we have responses for disasters that happen fairly frequently. So some of the ideas from the COVID response, the innovation from here, we're hoping we can apply those to other disasters to make emergency response as a whole better prepared to support people in general. We've also done a lot of gap analysis. So saying, okay, this is something that needs to be addressed. We need to give this information to this person. Where can we find resources for this? How can we connect the right resources together? So there's a lot of work like that on the ground. And because this is really a unique disaster, we've connected with a lot of disability integration advisors in different regions, asking, what they're doing in their specific areas to figure out how we can be creative about our approach and getting as many ideas as we can. So I'll go ahead and go to the next slide. And with that, I will turn the time over to Roxanne Crawford, who will be discussing the regional perspective. Thank you.
Hi, everyone. This is Roxy. I'm Region 9 Disability Integration Specialist, and I had the pleasure of working with Charlotte when she was deployed to support California. So a lot of the things that I'll talk about today, kind of got covered partially by Charlotte, but I think it's important to highlight some of the perspective from the regional disability integration specialists. There's one of us for each region, as mentioned before, and never in history have we been activated where all of our states and territories, every single one, is activated at the same time, but working at different paces and having different impact levels from COVID. Everything from American Samoa they still have 0 cases of COVID and 0 deaths, all the way to, California and Arizona, which are still, struggling through the impacts of COVID. So some of the major things that we really tried to focus on as regional disability integration specialists are monitoring developments in COVID testing and testing priorities that allow for improved disability access. So what that access looks like for us, working with local disability organizations and with organizations like the Pacific ADA to identify access concerns and to be a conduit of information flow between emergency management and in the organizations and groups running these testing centers back through the organizations and the community, expressing challenges and access issues that were faced at those times. Monitoring disability stakeholder concerns related to restrictions being lifted in the states. Specifically, I put in here restrictions being lifted in the states, though we monitor disability stakeholder concerns throughout the process, everything from testing to shortages in equipment and services, but specifically related to restrictions being lifted in the states, because that's still an ongoing thing. As restrictions are lifted and restrictions are reinstituted, such as in California, where many of the counties went up a phase and then came right back down as the cases increased. Concerns related to a strong desire to not be left behind as things reopen for those who aren't able to go back out at the same pace. People who, there were many concerns about individuals who maybe had COVID thinking they couldn't get COVID again, and creating kind of a separate group of individuals who maybe were less afraid or being less careful. So being able to take information from stakeholders who are gathering information from their clients and constituents and bringing that back to emergency management, making sure that that information is passed on and received by states and organizations involved in community services and decision-making in general. Again, with the monitoring information, watching that PPE or personal preparedness equipment flow and shortfalls as it relates to in-home care services, ensuring people with disabilities could remain in their residences and to mitigate additional burdens on long-term care facilities. So really, again, taking information that was being gathered, that was being heard by local organizations, by state level organizations, and bringing that up to ensure that it's receiving the appropriate attention from emergency management, and that we're able to answer immediate needs. Things like this center is out of personal preparedness or personal protective equipment, like gloves and masks, and what can we do to fix those concerns or get them in contact with the correct people in the logistics team. You can go to the next slide, thank you. So continuing on, engaging disability stakeholders in local, state, and national COVID recovery and economic stabilization efforts. following along those same lines, really, the key to all of the work that we did in the regions, just about all of the work, really comes down to those relationships and partnerships with disability organizations and with our partners like Pacific ADA and like independent living centers, who really are out there doing the hard work. Providing input to initial crisis counseling applications and coordinating disability stakeholder involvement really worked to bring recommendations from our partners, from representatives in disability community, to SAMHSA and state and federal individuals who are coordinating the crisis counseling effort, because we really needed to creatively address issues related to a virtual delivery of crisis counseling. There's always access issues when it comes to providing services, and we do, typically have to be creative and have to do lots of work to make sure that we are hearing what the access issues are and addressing them. But we wanted to make sure to get in kind of ahead of the game here when it came to this virtual delivery, and make sure that the information coming out to individuals related to crisis counseling supported those needs. Submitting requests for information regarding accessibility and mission assignment actions, that really highlights the partnership between ODIC and the Regional Disability Integration Specialists, between having regular phone calls and passing information up the chain that could be considered very important for that headquarters level to receive. We also were able to put in formal requests for information and receive formal documents and processes back from Office of Disability Integration Coordination and other areas like external affairs and logistics up at that headquarters level. Engaging and supporting state level counterparts with technical assistance for state and local inclusion strategies. Really bringing our partners together with emergency management. We have a number of different success stories from other regions that people kind of sent up to me. So like the Ohio Long-Term Care Strike Team, bringing together the Ohio Department of Health and Ohio State University to mitigate COVID outbreaks in long-term care facilities. So really engaging those state level counterparts and connecting them with other organizations and other counterparts who could work together to enact real change and successes. You could go to the next slide, please. Collaborating with state, tribal, territory, and federal partners, of course, on every level. We can't just talk with FEMA, and we can't just talk with our external partners. We also have to be really engaged with our state partners, whether or not we have a disability integration or access coordinator in that state or not. Finding the right person to work with in the state and ensure that these are state or tribal or territory, to make sure that these very important concerns are being addressed every single day and being looked at every single day with that perspective in mind. And the biggest success really when it comes to this COVID response is the guidelines, the information, the talking points, things that were developed by partner agencies that FEMA, the Regional Disability Integration Specialists, the DIADs, the Disability Integration Advisors, were able to amplify. The things that came out of the state of California, the state of Washington, other states, those were used nationally and adapted for use in other areas. But that kind of ability to amplify the fantastic work that's been going on by state disability advisory groups and by disability organizations down in the thick of it in the communities is really the success story here. There were a number of different successes from Region 6 DHHS office and civil rights program analysts being connected and working to find solutions to civil rights cases during COVID. that comes down to the regional disability integration specialist being able to monitor complaints that are coming in and referring them to the most appropriate area. So, you know, again, as a regional disability integration specialist, I would say the biggest best practices, the biggest takeaways are to really maintain open communication and build strong relationships before, during, and after any type of response with the organizations in our regions. Thank you. I am going to turn it over to the next speaker. Unless there's any questions. I don't know if we're taking questions now.
Hello, everyone. My name is Candace Alder. I'm a policy analyst with the Office of Disability Integration and Coordination. I specifically work with the Public Assistance Program to look at how public assistance affects federal dollars that can provide accessibility to communities and make sure that we are including people with disabilities. Throughout this presentation so far, you've heard a lot of reference to Category B funding through the Public Assistance Program. And so I wanted to talk a little bit about what public assistance grants is, how public assistance grants impact state, local, tribal, territorial governments, and private nonprofits. And so with that, I'm going to talk about FEMA's financial support. So the state, local, tribal, and territorial government entities and certain nonprofit organizations can apply for public assistance reimbursements during disasters. And specifically in COVID, the COVID disaster really focused on those emergency protective measures taken during the pandemic. ODIC, the Office of Disability Integration and Coordination, is currently still actively engaged with public assistance through policy reviews, looking at how FEMA's current policies can be amplified and more inclusive of persons with disabilities and communities, and make sure that we're including the right accessibility approaches. Our directives, we look at different ways that we can engage with our stakeholders and inform them. We have a lot of working group collaborations as well. And within those working groups, we try to see how we can engage with disability stakeholders to address increased accessibility opportunities through public assistance funding. A lot of what we see is that there are opportunities within public assistance funding. And there was a question earlier about how do we make sure that communities receive food if they can't reach a certain site. Well, that's up to the state, local government, territorial, or the private nonprofit that they're supporting through public assistance funds. But we do offer technical assistance through the public assistance funds to talk about how to utilize that funding for inclusiveness. Next slide, please. So again, we were talking about emergency protective measures, or Category B funding. And under Category B funding, emergency protective measures are defined as immediate actions that are necessary to protect the public health and safety. And that could be during a pandemic, but it also covers other disasters as well. And to be eligible for public assistance, an item of work must first and foremost be the legal responsibility of the eligible applicant. So typically when we talk about eligible applicants, we're talking about states, local governments, territorial governments, tribal governments. And these measures are to protect the life, public health, and safety. And generally speaking, that is the responsibility of the states, the local governments, and the tribal and territorial governments. And those legally responsible governments can either conduct the work themselves or they can enter into formal agreements or contracts with either private or nonprofit organizations to conduct the work. But essentially, the eligible applicant for public assistance funding is usually our state, local, tribal, territorial governments, and they're the ones who are legally responsible along with their contractors. So when we're looking at managing and controlling and reducing the immediate threats to public health and safety, there's a non-exhaustive list that kind of covers what public assistance funding can provide. Some of them include things like emergency operation costs, but it also could be training specific to the declared event. So training on COVID, disinfection of eligible public facilities, and so forth. There's also like non-deferrable medical facility or sheltering. There's also medical supplies, communications of general health and safety information to the public, search and rescue. I actually have a link to that non-exhaustive list. And so I'm going to go ahead and provide that to you via the text box here. FEMA.gov has a lot of really great fact sheets available to everyone. And it talks specifically about what these protective measures look like. And so you can refer to that document. In terms of private nonprofits, they can be considered as sub-applicants to receive support through their state, local, territorial, or tribal emergency management office. FEMA itself does not provide funding directly to a private nonprofit, so private nonprofits need to work with their states and their emergency management office. A lot of times private nonprofits will be funded through the state office to mitigate or to work together to provide a certain function. States contract or enter into agreements with private nonprofit entities to carry out specific types of work. And then whichever agency that might either be providing this type of assistance or services should work with their emergency state management offices as appropriate to coordinate the reimbursement of those types of services. Okay, next slide, please. Okay, I am going to turn it over now to my colleague, Ed Ahern, to talk about individual assistance.
Good afternoon, everyone. Good morning. This is Ed Ahern, and I am a program analyst with the Office of Disability Integration and Coordination. And my focus is primarily on the individual assistance service that FEMA provides. And have the next slide, please. So traditionally, the individual assistance service is utilized when there are when a disaster affects an individual's house or personal belongings. With the COVID pandemic response, there was not that type of focus. So one of the first things that we saw is we saw IA really start to look at how were they going to provide support for disaster season, for hurricane season, in the environment around pandemics. So throughout the pandemic, IA has been really forward-leaning and engaging disability integration throughout their discussions. What we've seen is they are realizing that existing policies and processes may need to be modified. And from the very beginning at looking at those policies, they have included disability subject matter expertise in those discussions, which has been really, really helpful. One thing to note that our individual assistance section does have a disability integration specialist that's part of their team. And that's a very proactive approach that they took a number of years ago so that we can be sure that disability issues are really being addressed across IA. During this COVID pandemic process, Charlotte mentioned earlier that we were supporting the NRCC, the National Response Coordination Center, and we are still doing that today. One of the areas that we've really been trying to support our IA folks, our IA colleagues, is through that NRCC, and we are still doing it now, still engaging in dialogue with them around issues that that they are working with in the NRCC. So one of the things that we're really seeing is an increase in addressing disability issues throughout policies and programming. They're already discussing the issues. What we've also seen is an increase in opportunities for training the IA staff during this time. We have a lot of people who are very attentive and they're working from home. So we've provided a number of trainings to IA staff around items such as how to interact with people with disabilities. What is the role of headquarters ODIC, the regional disability integration specialists, and our deployed staff. So really bringing awareness around our role in disability integration throughout the IA cadre, which is pretty significant. Again, there wasn't a lot of focus on the individual assistance services. So what, again, we did see with IA was them begin to jump into reviewing and planning around some of the things that we might need to be aware of, given that we were into hurricane season. How will we shelter individuals in this environment? How will we feed them? So we had a number of work groups where we really dove down deep, and disability integration issues were included from the very beginning. So as IA would roll out some new guidance, they were really inclusive of how the needs of people with disabilities are going to be addressed. One of the areas we saw an immediate kind of action on the part of individual assistants is our housing inspection. For instance, we had a number of active disasters. So we had to retool how those inspections were occurring. And all during the process of moving toward a virtual inspection process, the needs of people with disabilities had been considered. So some of the areas now that we're still seeing need is that further discussion around what the services will be and how they will be provided in a virtual environment. As was mentioned earlier, crisis counseling, which is one of the services available through IA, through their mass care program, has really begun to stepped up planning on the best way to accommodate people with disabilities during that process. So while it's been a slow time for the individual assistance service, there has been no shortage of activity and great work going on to really prepare staff even more than they've been prepared. So a lot of work has been going around revisioning what does our disaster recovery centers look like. And throughout all of those discussions, we've been able to really provide some very good disability subject matter expertise so that when those processes were rewritten and retooled, they were really more inclusive of people with disabilities. We have great success in working with our individual assistants who are very open to the guidance that ODIC supports, and we continue to do that in a number of arenas. And next slide, please. So just to build on a little more, and I'll look to Candace in a minute as well, but one of the areas that we've really been focusing on is congregate and non-congregate shelters. You know, so FEMA's really been making extensive efforts, not only to continue normal disaster preparations, but to prepare for those disasters in the COVID environment. Candace and I were involved in a number of very, very detailed planning groups, specifically around things like sheltering and feeding. And she and I have had some great discussions about really just how inclusive IA has been around some of these areas. Candace?
Hi, this is Candace. So as Ed mentioned a little bit, we have all the other disasters that have happened throughout our nation don't just get put on hold because we're in a COVID-19 environment. So a lot of discussions due to these concurrent emergency declarations, including in the last a little while, we've even looked at tornadoes, some flooding, we've had a couple of hurricanes come through. And that's really created some challenges for us to think about how do we shelter individuals and also individuals with disabilities who might need shelter services but can't do so in an environment where everybody's all in one room. So how do we protect the health and safety and how do we address concerns over social distancing? So we, the Office of Disability Integration and Coordination, we're serving on several working groups within FEMA to engage with disability stakeholders and talk about non-congregate sheltering. So things like options such as hotels, looking at dormitory rooms, you know, other alternate options to keep people safe and shelter them during a subsequent disaster. And so we've been doing some extensive work in revising a lot of policies, updating some of the language, and making sure that we're addressing accessibility and inclusive language. So that's pretty much what we've been kind of working on. We're also looking at under category B for FEMA's public assistance program, states, local governments, tribal and territorial governments can request assistance for this type of congregate or non-congregate sheltering and support through that, which is not something that we see in every typical disaster. So we're looking at new and innovative ways to shelter people in a COVID environment. Next slide, please. I'm going to talk a little bit about access to effective communication. Early in the COVID environment, we were tracking through the NRCC, the National Response Coordination Center, some information that we were receiving from our regional disability integration specialists that talked a little bit about concerns about access to effective communication. And we were hearing from the disability community that there were gaps in communication access within emergency press briefings, testing sites, and medical treatment. So we worked alongside with the CDC to help support them in their efforts to provide resources. And as a result of that, FEMA supported the CDC with some of the videos that were produced and put up on their website that were in American Sign Language. Now, I don't work for the Office of External Affairs, but we do work together sometimes on projects, and the Office of External Affairs supported the CDC on the content and development and distribution of informative ASL videos. And as we were kind of looking at and receiving information about these concerns, we thought about how might Category B emergency protective funding affect communication access? And within those covered activities that I mentioned earlier, communications for states, tribal governments, local governments, territorial governments, if they're needing FEMA assistance, they can apply for communication assistance as well. And that can also include the provision of the auxiliary aids and services. So they can look to Category B funding to maybe pay for and support some of those activities. So the Office of Disability Integration and Coordination, we created a fact sheet on emergency protective measures for emergency broadcasts so that states, local governments, tribal governments, and territorial governments can understand how they can potentially utilize FEMA's public assistance funding for emergency communications. Okay, next slide, please. A little bit earlier in the presentation, we talked a little bit about the CDC and ensuring civil rights. Obviously, civil rights in this COVID environment is very important, and FEMA's Office of Equal Rights issued a ensuring civil rights during the COVID-19 response statement, reminding FEMA and our partners, our state, local, territorial, tribal partners that receive federal funding, and any kind of non-governmental relief and disaster organization, reminding them that civil rights laws and legal authorities, including those related to persons with disabilities, remain in effect during emergencies and cannot be waived. The document also offers best practices and resources related to civil rights obligations, including disability. I will go ahead and add that to the chat here for everyone to be able to access. And with that, I'm going to turn it back over to my colleague, Jessica.
Okay, hi everyone. Okay, so I mentioned the ensuring civil rights during the COVID-19 response, I believe earlier, and sent a link, but it looks like there's also a link here to that document. Oh, so this is the document from the Office of Equal Rights, but similarly has to do with ensuring the civil rights of people with disabilities and other civil rights during COVID-19 response. Next slide, please. And the next slide. Okay, so ODIC hosts a monthly stakeholder engagement call. Our first of these calls took place last month, and we had a really great participation. A lot of people joined the call. And what we did was we each went through our presentations of what we wanted to share with everyone. And then at the end, we had time for Q&A. And we were able to answer a lot of questions that stakeholders called. So if you're interested in signing up for information about how to join future stakeholder engagement calls, they might happen about once a month. You can sign up by sending an email to FEMA-disability-integration-coordination at fema.dhs.gov. So just go ahead and send us an email and ask to be added to the listserv, and we'll make sure that you get information about how to join the calls and also how to send in questions that you'd like to have us answer during the Q&A portion of the call. Next slide, please. And with this, it looks like we have time for questions.
All right, thank you so much, Charlotte and Jessica and Roxy and Candace and Ed, all of our speakers from FEMA. Thank you so much. This is, all of you, this is the time to submit your questions in the chat window, and we will start to address them now. The first question had to do, Jessica, I know that you put some information up, but somebody was asking about whether there was data on IDD and COVID that was in the public as opposed to an NPR report, public data that would be available. Do you know about that?
This is Jessica. Is that specific to people with intellectual disabilities?
The question did ask about that, yes.
Yes, okay, perfect. Yes, so actually if you go to the NPR article that I sent out, there's a link in that article to the original studies. So the NPR article just gives you a summary overview of what's in the original study, but there's a link in that article so you can read the original as well.
Okay, great. I want to remind everybody that there are a lot of detail got put into the chat window, so make sure that you are going in there and finding all of that. Let's see. For those of you who are asked about if the slides are available to access, the slides are available at www.adapresentations.org in the schedule page. Today, by tomorrow it'll be in the archives section. So next question. Are there strike teams in every state? I believe this happened early on during either Jessica or Roxy's information.
This is Roxy. I think it was probably in response to the information I shared about how effective what happened in Ohio was. I don't believe that there are strike teams in every state. I do think that each state has taken into account what they feel is the best effort and response for them. I can say, while there may not be a strike team in every state, there are teams of individuals who are daily processing information and working together to find solutions to emerging issues. I definitely think, we're recording best practices from every region and trying to take into account things that we think went really well, like that strike team in Ohio, and providing that information up through our regional contacts in each state to say, hey, did you see what happened in this other state? I'd love to put you in contact with someone or find ways to help you if you think this would work here as well. Does that help?
Okay, we're going to assume for now that that's okay, and we'll hear from the person if that's not. The next question, and you may have answered this already, Candace, but person asks, I hear a lot about Category B funding, and I know several centers for independent living have talked about applying, but I haven't heard that any have gotten it. Can you talk about the best process for this?
Hi, Lewis. This is Candace, and thank you for that question. One of the things I touched on in my part of the presentation was that a lot of times private nonprofits are not directly funded by FEMA, so they want to work with their state agencies. They want to work with their state emergency management office. If Centers for Independent Living are supporting disaster response through their state, they should get into these contractual agreements and have these conversations about what these costs are and whether they can be reimbursable through their states, and then the states get reimbursed through FEMA. So I think the first thing to do is to have conversations with their state emergency management office, talk to them about what those costs are that the independent living centers are accruing, and what kind of emergency protective measures are they supporting. So that way the states can then evaluate if to make that, that independent living center a sub-applicant for FEMA assistance.
All right, thanks for that. The next question, I believe, is for you, could be for me. Do you provide ESL translator services?
Hi, this is Charlotte. I can pick that one up. So FEMA, we have a language team in the Office of External Affairs, and they're responsible for ensuring that the information is being properly distributed in a variety of languages. And of course, we need to identify the population that needs that specific language service and then coordinate what information needs to be distributed in that specific language and where. And there are some people, you know, maybe in-house, some people that we contract out, but FEMA focuses on making sure that we provide effective communication. So again, as we depend on feedback from the community, we want to get that feedback from you about what's happening, what services or communication access is missing. So please reach out to us and we can make sure we pass that along to the right group and hopefully address that and give the community the information that they need. We don't provide language services outside of emergency response, so we'll keep that in mind as well.
Thank you. All right, next question. Can you provide any insight on why FEMA funding for meal programs is age limited and does not extend to people with disabilities under the age of 60 who otherwise met the qualifications for the services, including being at high risk due to COVID? In California, the program is called Great Plates Delivered.
Hi everyone, this is Jessica. So I was, Roxy, you might, since this is in your region, if it's a California, you might have something to say as well. I was only going to say that the stipulations that states put on certain of their programs is not, it's not a federal stipulation. So for instance, I know the restaurants program that was delivering food, I believe, again, Roxy could probably speak to this better than I could, but I believe it was envisioned as meal deliveries that would go to senior citizens, for example, right? So, okay, I'm reading this chat box. Yeah, so let me get you a better answer. Okay.
This is Charlotte. So yes, that was one of the things that was discussed when I was deployed to California as well, as far as, you know, what that program was. And that program was actually intended to provide outreach for people who are above the age of 65, specifically for senior citizens. And in the state of California, that was an identified gap because Meals on Wheels was really struggling to try to meet all of the demands and the high needs at the time because transportation was limited, grocery stores were limited for whatever reason. So the state felt like they wanted to develop a program that was targeting seniors and individuals over the age of 65. So I think that the intent of the program there was not necessarily focusing on people with disabilities. So that's something that it would probably be a good idea to discuss with the state to figure out, okay, let's see if we can expand this program to add specific focuses or figure out how we can connect to specific groups.
All right, thank you. Next question. A great many people with intellectual and developmental disabilities lack technology access. Does FEMA have a plan to reach those without smartphones, tablets, or technology?
Hi, this is Charlotte again. We can probably pass that. Well, I don't want to answer for the Office of External Affairs and for individual assistants on their strategic approach for outreach. So I will have to reach out to the office and maybe get their approach and strategy for reaching out to people who don't have access to technology, because I don't want to give you the wrong information.
All right, next question. How could regional disability integration specialists work with the state that does not have an AFN coordinator or ADA coordinator at an emergency operations center? Sometimes I perceive the state is in the controls between the counties, including cities, and the federal. Is there a solution to approach the State Emergency Operations Center to open up RDIS for further assistance? Anybody want to answer that one?
Hey, Louis,
This is Charlotte.
Candace. Go ahead, Charlotte.
Oh, go ahead. Go ahead, Candace.
I was just going to say that I think Roxy might have dropped off, and I think she might be the right person to answer this question. So I'll go ahead and bring this question to her and get an answer from her.
All right. Yeah, this is the challenge of running a webinar in COVID-19 ourselves. Everybody's in disparate places and not everybody are all not looking at each other in the same office saying, you take this question. All right. Next question. With all the controversy regarding masks and some counties, cities making them mandatory, what can be done so that deaf people do not lose their ability to communicate since they are not able to read lips due to the masks?
This is Candace. I'm going to have Jason Legria answer this question.
Jason, you may need to unmute yourself.
Apologies about that. I have two mute buttons. I have a physical one and a digital one. My name is Jason Legria. I'm an attorney at FEMA, and I'm embedded in the Office of Disability Integration and Coordination, as well as the Office of Equal Rights. So I am a practicing civil rights attorney. I know there's a lot of questions about face masks, and I'll say a couple things. First, there has been some guidance released by the federal government on face masks. The first is one from the Department of Justice. They released their June 30 press release saying, addressing a lot of these cards that people are sharing on social media, saying the ADA exempts people from wearing masks for being fraudulent. And the press release explicitly stated that the ADA does not provide a blanket exemption to people with disabilities from complying with legitimate safety requirements necessary for safe operations. And it directs people to visit ADA.gov and call the ADA information line if they have any questions. The second piece of guidance that came out that I think is helpful is from the Equal Employment Opportunity Commission. The jurisdiction of the EEOC is employment, but a lot of the analysis that is done in the employment world when it comes to disabilities is applicable in many other circumstances. So, you know, the EEOC has also stated that in the employment context that an employer is allowed to require employees to wear protective gear such as masks and observe infection control practices. However, when an employee asks for a reasonable accommodation under the ADA or religious accommodation also, the employer should discuss this request and try to make a reasonable accommodation if it's feasible and it doesn't create an undue burden on the employer. So what can I say given all that? I can say this much. It's a case-by-case analysis of how we're treating masks under disability laws. Is very dependent on the facts, settings, the pandemic level in an area, and other risk factors. I know the questions was about clear face masks, and what I can say there is, if employers need their employees to wear masks, but they need to accommodate people with disabilities, there is a duty on them to try to accommodate. So maybe it does mean clear face masks. It might mean other technology. It might mean writing things down on paper. It might mean using some sort of technology. But there is this requirement on people who are operating out in the public to try to accommodate. So even though people might still need to wear masks, there are other requirements on them to try to accommodate and serve people with disabilities in one other way. So yeah, again, it could be a mask, but it could be other ways too.
Thank you, Jason. And I realize now that we are a little over time, and I apologize about that. We were getting into some really interesting questions. I do want to add to Jason's answer. If you have a question about your specific area regarding an issue that is an ADA kind of issue like this topic, you can call your regional ADA center at 1-800-949-4232, and that is true for some of the questions that have come in, including how places can evaluate their temporary sheltering sites. That is a good answer, a good question for your ADA centers to answer. And so we apologize. I see there's a lot of questions lined up there. I'm sorry that we're not able to get to them and we've run out of time. But if you have a question, you think it's an ADA question, you can call us at 1-800-949-4232. You're going to receive an email with a link to an online session evaluation. Please complete that evaluation for today's program, as we value your input and want to demonstrate our value to our funder. We want to thank all of our speakers today for sharing their time and knowledge with us. It was a very informative session. A reminder that today's session was recorded and it will be available for viewing next week at adapresentations.org in the archive section of emergency management. Our next webinar on September 10th will be joined by the Listos California campaign on emergency preparedness for National Preparedness Month for a presentation on the program's novel state-based approach to whole community preparedness. We hope you can join us. Watch your email 2 weeks ahead of time for the announcement of the opening of registration. Thank you very much for attending today's session. Have a good rest of your day. Thank you all of our speakers. Thanks again for being here. And have a good rest of your day, everybody.